Hello, I'm Keisha Jackson, a third-year pharmacy candidate from Fort Lauderdale, Florida, and my journal club is titled Inhaled Technosphere Insulin Compared with Injected Prandial Insulin in Type 1 Diabetes. This was a randomized trial of 24 weeks. So when I say technosphere insulin, I'm going to be saying TI a lot. So to conclude, this study was funded by Mankind Corporation. Sanofi has worldwide license for Technosphere insulin. So it was funded by Mankind Corporation along with Atlanta Diabetes Association, which gave them grants and research support because of its employer, Bruce Boyd, also an author of the article. The background of this study to compare the efficacy and safety of TI and insulin aspart, a rapid-acting insulin, in patients with type 1 diabetes. The objective, the primary goal of the study was to demonstrate non-inferiority of TI delivered through the Gen 2 device, which is an inhaler, oral inhalation, in combination with basal insulin compared to insulin aspart, in combination with basal insulin and its effect on hemoglobin A1C in patients with type 1 diabetes. The trial design, it was open label, multi-centered, and randomized study. The locations took place in 90 study locations in the US, Brazil, Russia/Ukraine. Approval was approved by the appropriate independent ethics committees and institutional review boards. Exclusion criteria. Men and women 18 years of age. Inclusion criteria, Men and women 18 years of age or older. Clinical diagnosis of type 1 diabetes for at least 12 months. Body mass index, BMI of 38 kilograms per meter squared. They have to be on a stable dose of basal insulin for at least 3 months. And the fasting plasma glucose consistent with less than 220 milligrams per deciliter. Exclusion criteria included you can't have significant pulmonary disease, chest x-ray abnormalities, malignancies within 5 years, and women who are pregnant should not take place in this trial. Subjects included both male and female, 18 years and older, who have type 1 diabetes. So we're going to go to our primary and secondary endpoints. The primary efficacy endpoint was to change overall the HbA1c from the end of basal optimization baseline to week 24 in patients with TI Gen 2 inhalers along with insulin aspart group. The secondary outcome, patients achieving hemoglobin A1C of less than or equal to 7%, proportion of patients achieving HbA1c less than 6.5%, and then a change in fasting plasma glucose from baseline to week 24. We followed up. The follow-up of the trial happened at week 28. This is 4 weeks after patients converted back to their original prandial insulin, aspart. Duration of the whole trial was 24 weeks, and the population, as previously stated, included male and female 18 years and older with type 1 diabetes. So the treatment arms. We have the two experimental groups. We have the Technosphere insulin, the TI with Medtone inhaler. These subjects would take the TI with Medtone inhaler along with the basal insulin that they were previously on before entry. And then another experimental group, they take the Technosphere insulin Gen 2 along with the basal insulin that they were previously on before entry, and compare those groups with aspart group, who are receiving the aspart and the basal insulin that they were prior on before the study as well. Some statistical analysis information. Total amount of patients in this study was 1,401. 614 of whom entered the basal insulin optimization phase, and 518 were randomly chosen for the TI Gen 2 aspart and medtone group. 174 were included in both the TI Gen 2 group and the TI medtone group, and 170 was in the insulin aspart group. We had dropout rates for TI Gen 2, insulin aspart group, and TI medtone groups of 25.3%, 11.2%, and 20.7%. Respectively, they were due because of the withdrawal out of the trial due to changing jobs. But we also had adverse events that occurred with Technosphere insulin that caused withdrawal from the trial as well. When we're comparing the hypoglycemia rate, we compare the hypoglycemia rate from Technosphere group with aspart group, and the Technosphere insulin group had a lower hypoglycemia rate than aspart group. So we used the mixed effect model repeated measure analysis and preferred model for addressing missing data. Analysis performed based on completers population, or the conventional last observation carried forward imputation method, confirmed the conclusion from the primary MMRM analysis based on the full analysis set. Furthermore, sensitivity and analysis such as pattern, mixture, and multiple imputation analysis concluded that the impact of missing data is insignificant to the conclusion of non-inferiority. So my baseline characteristics, I'll briefly go through those. The patient had to be 18 years or older, male or female, with type 1 diabetes for at least 12 months. We had a group range of 18 to 30, 31 to 49 years, and 50 to 64 years old and greater than 65 years old. Those all totaling 518. The race of the participants included Asians, that was only two of the members. Native Hawaiian or other Pacific and Islander, that was one of the members. Black African Americans, 16 members. White was a big group, 497, and unknown or not reported was 2. Our mean duration of diabetes amongst all participants was 16.8 years, and the mean weight of all participants in kilograms was 75.1 kilograms. The mean BMI of all participants was 25.9. Mean fasting blood glucose of all participants was 150.2 milligrams per deciliter. The mean hemoglobin H1C of participants were 7.95%. To go over some adverse events that occurred, mainly with the inhaled oral inhalation Technosphere insulin, we saw cough, mild to moderate cough, and was predominantly dry and intermediate, and stopped after 8 weeks of the trial. So majority of the cough took place the first 2 weeks of the trial with the Technosphere insulin Gen 2 and medtone. Author's conclusion: the result of this trial demonstrated that regimen of prandial Technosphere insulin in combination with basal insulin is non-inferior to a standard regimen of basal insulin plus prandial rapid-acting insulin like aspart for reducing hemoglobin A1C in patients with type 1 diabetes. The strengths of this trial: the study was multi-centered, randomized, and included a large range of ages and race. With use of Technosphere insulin, some adverse effects were desirable, like weight loss in some patients. Weaknesses: study included a sample size of 518 participants, which in 24 weeks, the duration of study was 24 weeks, which is short duration for monitoring outcomes. And adverse events such as cough and unexpected accidents led to trial dropouts and death by drowning, not related to the specific trial, thus slowing the sample size also. In conclusion, in the summary of the literature, 24-week studies showed that regimen of prandial TI in combination with basal insulin led to non-inferiority reduction in glycemic parameters, with weight neutrality and less hypoglycemia compared with subcutaneous aspart. However, TI Gen 2 enabled fewer patients to achieve hemoglobin A1C less than 7, most likely due to higher glucose levels in the last postprandial period, from 2 to 5 hours post-inhalation. And in conclusion, the need for intensive glycemic control in patients with type 1 diabetes with insulin as treatment is a daily routine. For many patients, hypoglycemia, weight gain, and a burden of multiple injections lead to poor adherence. The lack of compliance with insulin therapy is a frequent problem in patients with type 1 diabetes due to pain, the embarrassment associated with insulin injection. However, if patients have inhaled prandial insulin, we could eliminate some of the barriers of treatment and could provide important therapeutic options for individuals' diabetes management. Technosphere insulin TI by Mankind Corporation is dry powder formulation of regular human insulin absorbed onto Technosphere microparticles for oral inhalation. Upon inhalation, microparticles can reach the deep lung where they dissolve rapidly because of physiological pH, allowing absorption of insulin and FDKP into systemic circulation with a time of maximum serum insulin concentration of 12 to 5 minutes. So, in conclusion, the results of this trial demonstrates that the regimen of prandial Technosphere insulin in combination with basal insulin is non-inferior to a standard regimen of basal insulin plus prandial rapid-acting aspart for reducing HbA1c in patients with type 1 diabetes. But if you're interested in using Technosphere insulin, Mankind Corporation has a website, and they do say that it is fairly cheap compared to some other inhaled insulins. So, in conclusion, thank you for your time.